All right, so we're going to talk about skin disorders in this section, then we're going to continue to talk about it, but specifically infections and cancers in the next section. So it's weird to think about your skin being disordered, but yes, there are disorders that affect your skin. Some of them are systemic disorders that manifest on the skin, and some of them are just the skin. So the learning objectives for this, we're going to define pruritus, even though we talked about it a little bit in the first lecture. We're going to talk about diagnostic testing and treatment for skin disorders. We're going to name and describe common lesions found with particular disorders of dermatitis, boils, and herpes zoster. And the boils and herpes zoster part, we're going to talk more about in the infection chapter, because that's what those are. And furuncles is the official word for boils, and I just think that's such a weird 14th century word. I don't know why it's persisted, but I guess it has. We want to describe the manifestations and causative agents of shingles, boils, scabies, and scleroderma. So some of them we're going to talk about in this section, some of them we're going to talk about in the next section. Pruritus is itching, as we said before, and it's associated with allergic responses or chemical irritation, sometimes caused by insect bites because they inject their little chemicals into you. It can be caused by infestations of parasites such as scabies. Ugh, very gross. The mechanism of pruritus is not totally understood, but there can be the release of histamine and a hypersensitivity response with allergic reactions can cause marked pruritus. So you can have itching. Infection might result from breaking the skin barrier. It may be caused by itching. So when we break that skin barrier, we're giving opportunistic pathogens a way in, and that can, so itching, you shouldn't scratch. You should get treatment other than scratching because you don't want to break your skin barrier. So diagnostic tests that they'll often do for skin disorders, culture and staining of specimens. So if you have exudate, they want to culture it. Sometimes they're going to look at it under the microscope or by direct observation to look at bacterial infections. There are specific procedures required to culture fungal or parasitic infections because remember, those guys are eukaryotes, and it's harder to culture eukaryotes. Prokaryotes, it's easy to culture them, and it's different procedures for fungal or parasitic. A biopsy is used to detect malignant changes or sometimes as a safeguard prior to or following removal of skin lesions. So sometimes they remove a skin lesion and they'll biopsy it just to make sure that it's not cancerous. Blood tests can be helpful in diagnosing allergic conditions or abnormal immune reactions. And skin testing for allergies can be done using a patch or scratch method. It's usually done at a dermatologist or an allergy clinic. And they put a little bit of the allergen on your skin, and the positive test is that it turns red and itchy and maybe develops a little lump. So general treatments for pruritus is usually treated by topical agents to reduce sensation. It might be treated by antihistamines or glucocorticoids if it is caused by an allergic reaction. Avoidance of allergens. That makes sense to reduce the risk of reoccurrence. So if you know you're allergic to latex, avoid latex and don't irritate your skin in the first place. Infections may require antibiotic treatment, and precancerous lesions, a little more serious, surgery, laser therapy, electrodesiccation, or cryosurgery. So definitely when we're talking about cancer, we don't want to mess with it, and you got to get right in there because before it gets worse, it spreads to other parts of your body. We'll talk more about cancer, skin cancer, particularly in the next section. So inflammatory disorders, one that a lot of us are familiar with is contact dermatitis. So this is a photo from the book, and you can tell exactly what this person was allergic to. They were allergic to the adhesive on a bandage on their skin, and a lot of times that's the indicator, like, oh, this is contact dermatitis, because whatever you were exposed to, you can see the shape of it on your skin. It's caused by exposure to an allergen like metals, cosmetics, soaps, chemicals, plants. Latex allergies often cause contact dermatitis. Adhesives in bandages are often latex, and that's what causes that. Sensitization occurs on the first exposure. and you develop a pruritic rash a few hours after the exposure. So contact dermatitis is considered direct chemical or mechanical irritation. So it's not caused by an immune response, and we'll talk about ones that are caused by an immune response. It's inflammatory because of the direct exposure. So if you remove the irritant, you remove the exposure and diminish the effect. It can be also treated with topical glucocorticoids to reduce the inflammation. So we know what causes it. We're exposed to it. If we reduce our exposure to that, we can avoid it. The pathophysiology of contact dermatitis is pretty interesting. You get sensitized on your first exposure, and then subsequent exposures result in manifestation, like a rash, itchy rash. The location of the lesion is a clue to the identity of the allergen. So in that previous slide, we had the picture of the bandage, like, oh, that's what you're allergic to. Poison ivy, if you walked through the woods, and I don't know, I grew up in the East Coast, there was a lot more poison ivy than there is um, where I am on the West Coast now. So poison ivy was a big thing. But if you're allergic to it, you're going to end up with contact dermatitis from walking through it. Signs and symptoms of allergic dermatitis: pruritic area, so itchy, erythematous, which means red, edematous, which means swollen, and often covered with small vesicles. So vesicle is a thin-walled, fluid-filled blister, basically. So itchy, red, swollen, and blisters. That's our signs and symptoms of allergic dermatitis. Chemical irritation has similar manifestations. Edematous, erythematous, it might be pruritic or painful. And the treatment is to remove the irritant, so like, wash it off or whatever, and topical glucocorticoids. Urticaria or hives are definitely not the same as contact dermatitis. They're caused by a type 1 hypersensitivity reaction, so it involves an immune response. It can be from ingestion of substances that you're allergic to, like shellfish, drugs, certain fruits, or other things that people are allergic to, or it can be caused by skin exposure of certain allergens as well. And you get an eruption of hard raised erythematous lesions. And here's a picture of one. So if you've ever had hives, you know what they're like. They're highly pruritic, they're itchy. They're found on the skin and maybe scattered all over the body, not just in the area where you were exposed to the pathogen. If it's an ingested allergen, it can cause an airway obstruction by causing hives in the pharyngeal mucosa. So that could be pretty serious. We don't want it. Hives are often a manifestation when you're experiencing anaphylaxis. So you want to check for swelling around the mouth and check the airway. If you have an EpiPen available, administer that ASAP. Get that going. Over-the-counter antihistamines are often used to treat hives. Corticosteroids, when it gets to the point where you need to go to the emergency room, if you have inflammation of the airways, and the immunosuppressant drugs that are used for chronic cases or children above 12. So those immunosuppressant drugs are more commonly used now. They're used for a lot of inflammatory diseases. So atopic dermatitis, also known as eczema, atopic is an inherited tendency. It's a common problem in infancy and it persists into adulthood. So in infancy, you get a red rash, erythematous rash with serous exudate. So it's that thin, clear exudate, and it's commonly on the face, chest, and shoulders. With adults, the rash tends to be dry, scaly, and itchy, pruritic, often on the flexor surfaces of the body. So it's a little bit different manifestations in children versus adults. It's chronic inflammation that results from response to allergens, and the body does mount an immune response. Affected areas can become sensitive to irritants from soaps or certain fabrics or temperature changes. That's difficult because can't really control that all the time. The potential complication of eczema is secondary infections due to scratching. This is particularly a problem with children because it's hard to keep them from scratching if it itches. The treatment is to eliminate the aggravating agent. Don't expose yourself to those certain fabrics or those soaps. Topical glucocorticoids and antihistamines. There are some medical treatments now that are not topical glucocorticoids. There are other topical medications. Because it's so common, they're always developing new treatments, which that's a good thing. Psoriasis is another chronic inflammatory skin disorder that affects 1 to 3% of the population, which is interesting, and it is believed to be genetic in origin. So eczema is an inherited tendency, and psoriasis is considered to be genetic as well. The onset of psoriasis is usually in your teenage years, just when you want the onset of a skin disorder. And it's marked by remission and exacerbation. Cases vary in severity, but it is another one that is an immune response. It results from abnormal T cell activation. And the result of the abnormal T cell activation is you get excessive proliferation of keratinocytes, which are at the top layer of the epidermis. And the cellular proliferation is greatly increased, leading to thickening of the dermis and epidermis. And you shed really quickly. So normally we shed our upper layer of our epidermis over like 2-week intervals. All the dust in your house is skin cells. And well, the dust in my house is probably skin cells and cat hair and dog hair, but I know you don't want to hear that, but it's true. But with psoriasis, the shedding occurs a lot faster. So you get buildup and shedding, buildup and shedding. And it can be small scaling spots or red patches of skin covered with silvery scales. And that's the remission exacerbation cycle. So you might be in one part of the cycle or another. When you're in the more aggravated stage, you might get dry, cracked skin that can bleed. And of course, you're open to opportunistic pathogens then because you have those fissures that they can get into. Your outer barrier is broken. It can have itching, burning, or soreness, thickened, pitted, or ridged nails. That's a good indication that it's systemic, is it's not just on one thing. And our nails are keratin as well as our hair. Swollen and stiff joints because those immune complexes build up in the joints. The treatment is glucocorticoids, tar preparations, which is a treatment for some other skin disorders, kind of interesting. Anti-metabolic methotrexate, which anti-metabolic, it keeps you from producing too many skin cells, and that's used in severe cases. And exposure to sunlight is often part of the treatment. So one treatment that PT used to be involved in was UV treatments. It used to be part of our body of knowledge, but now it's not as commonly done because there are more medications to treat psoriasis. And so it's sort of been crossed off the list of things that we do. Scleroderma is a systemic disorder that may manifest itself as a skin disorder. So it's systemic. It can affect your viscera, and the primary cause is unknown. So when you look at the word, sclero means hardening, and derma means skin, so hardening of the skin. There are increased collagen deposition in all cases. So they don't know what causes it, but that's the result. Inflammation and fibrosis are also present with decreased capillary networks, and it results in hard, shiny, tight, and movable areas of the skin. That's the scleroderma part. And it can result in impaired movement of the mouth and eyes because of that tight skin. It can also cause renal failure, intestinal obstruction, and respiratory failure caused by distortion of tissues. So it's pretty serious. There are a lot of signs that you can see, those hard, shiny, tight, immovable areas of skin. Fingertips are narrowed and shortened. And Raynaud's phenomena might be present where you have extreme reaction to cold in one or more fingers. Facial expression can be lost because the skin tightens and the movement of the mouth and eyes can be impaired. The cutaneous form of scleroderma may also affect the microcirculation of various organs, eventually causing renal failure, intestinal obstruction, or respiratory failure due to pulmonary hypertension. So, lots of different medication treatments based on the specific manifestations of the scleroderma. So, it's a pretty serious disease. They don't really know what causes it, and they can treat the symptoms and manifestations, but, if you don't know what's is causing something, it's hard to cure it.